Hello guys, my name is Sakshi and today I am with a new video on the topic periodontal flap. I hope you have liked my previous video and please don't forget to like, share and subscribe. Now let's begin. So what is periodontal flap? Definition. Periodontal flap is a section of gingiva or the mucosa that is surgically elevated from the underlying tissues to provide visibility and access to the bone and the root surface. So this is the definition of the periodontal flap. Now it is asked as an LAQ in the periodontology exam for about 10 marks. Basically the question comes as define periodontal flap, classify the periodontal flap and classify various techniques of the flap surgery, and even modified Weidman flap is one of the most common flap which is asked in the university examination. Now what's the classification? So according to the thickness of the flap or the bone exposure after the flap reflection, it is classified as full thickness, that is mucoperiosteal flap, in which all the soft tissues including the periosteum is elevated. Next is partial thickness or mucosal flap or split thickness flap, that is reflection of only the epithelium and a layer of underlying connective tissue. Now the second classification is according to the placement of the flap after surgery, that is non-displaced flap and displaced flap. Non-displaced flap is when the flap is returned and suture back to original position. Displaced flap is the flap is repositioned coronal, apical or lateral to original position. Third, according to the design of the flap or management of papillitis, conventional flap and papilla preservation flap. What is conventional flap? Splitting the papilla into facial half and lingual or palatal half. Example, modified Weidman flap, undisplaced and apically displaced flap. And papilla preservation flap is where entire papilla is incorporated into one of the more flaps. Now let's talk about modified Weidman flap. What are the steps in the procedure of the modified Weidman flap surgery? There are 7 steps. Step 1 is, it is an initial internal bevel incision that is 0.5 to 1 mm away from the gingival margin directed to the alveolar crest. Second, step 2 is the gingiva is reflected with the periosteal elevator. Step 3 is a clavicular incision is made from the bottom of the pocket of the bone, circumscribing the triangular wedge of the tissue containing the pocket lining. Step 4, after the flap is reflected, third incision that is made in the interdental space with the Orban's knife and gingival collar is removed. Step 5, all the tissue tags and the granulation tissue are removed with a curette and the root surfaces are checked and scaled. Step 6, bone architecture is not corrected, so good approximation of flaps is necessary. Every effort is made to adapt facial and lingual interproximal tissue. Step 7, interrupted direct sutures are placed in each interdental space and covered with a tetracycline ointment and periodontal surgical pack. So this all are the steps of modified Weidman flap. I would like to revise it again. Step 1. So first what we will do is we will give an internal bevel incision that is just given 0.5 to 1 mm away from the gingival margin. And then we will give the second incision that is after the reflection of mucoperiosteal flap, clavicular incision. That clavicular incision is just given from the base of the or the bottom of the pocket towards the alveolar crest. And the third incision, that is the interdental incision, it is given with Orban's knife in the interdental space. And then all the tissue tags and granulation tissue all are removed, the roots are checked and they are scaled and they are planned, and the bone architecture is not corrected, so the flap should be approximated in the right position. So every effort is made to adapt the facial lingual interproximal tissue, and then finally the interrupted sutures are placed and then it is covered with a tetracycline ointment or periodontal surgical pack. So for you to have a clear-cut understanding, I have made diagrams over here. Like I have told you that in the step 1, see, internal bevel incision is given, that is 0.5 to 1 mm away from gingival margin. And step 2, the gingiva is reflected. In the step 3, you can see that a clavicular incision is made and the whole gingival collar, that is the inflammatory granulation tissue surrounding the collar of the tooth, is removed. And in the step 4, interdental incision is made. And basically interdental incision is the third incision which is given after the clavicular incision. So here we can say like the interdental incision is given and a part of the tissue is removed over here. And in the step 5 we can see that all the tissue tags and the granulation tissue, they are removed and the root surfaces are scaled. And then in the step 6, placement of the interrupted direct sutures. You can take a picture of it. Now let's talk about the what are the different types of incisions in the periodontal flap surgery. There is horizontal incisions, under which comes internal bevel incision, cervical incision, and interdental incision. And next is vertical incision, thinning incision, cutback incision, and periosteal incision. So horizontal incisions. Now let's discuss about them. They are just directed along the margin of the gingiva, either in a mesial or a distal direction. Internal bevel incision is the reverse bevel incision. Objectives are it removes the pocket lining and it conserves the uninvolved outer surface of the gingiva, which if apically positioned becomes the attached gingiva. It creates sharp and thin flap margin is produced. The 11-15 surgical scalpel is used to make internal bevel incision, that is number 11 and number 15 surgical scalpel. Clavicular incision made from the base of the pocket to the crest of the bone, it is the second incision. The incision is carried around entire tooth with help of number 12 surgical blade. Purpose is to remove the inflammatory granulation tissue surrounding cervical area. Next is periosteal releasing incision. It is made with the help of number 15 or 15C surgical blade. Next is interdental incision. It is the third incision. It separates collar of the gingiva left around the tooth. It is given with Orban's knife. Vertical incision is used on one or both ends of horizontal incision depending on design and purpose of flap. Vertical incisions at both ends are necessary in the flap is to be apically placed. It must extend beyond mucogingival line reaching alveolar mucosa release of the flap to be displaced. Thinning incision. It extends from the gingiva towards the base of the flap in palatal flap and distal wedge procedures. Number 11 or number 15 surgical blade is used. Cutback incision. 11 or 15 number surgical blade made at apical aspect of the releasing incision. Now let's talk about the indications for the periodontal flap surgery. Periodontal flap surgery is indicated in the regions basically in gaining access for the root debridement, for reducing the pocket depth, for reshaping the soft and the hard tissues, for regeneration of the alveolar bone, periodontal ligament and the cementum. Next is indications of the modified Weidmann flap surgery. First is irregular bony contours, second is deep craters, third grade 3 or grade 2 furcation involvement, fourth root resection or hemisection, 5 intrabony pockets on distal areas of last molars, and 6 persistent inflammation in areas with moderate to deep pockets. Now, what are the contraindications of the modified Weidmann flap surgery or the periodontal flap surgery? That is uncontrolled medical conditions, which includes unstable angina, uncontrolled diabetes, uncontrolled hypertension, myocardial infarction or stroke within 6 months, poor plaque control, high caries rate, and unrealistic patient expectations or desires. So hence by this I have completed periodontal flap surgery, and it is asked in the university examination. Basically the most commonest question which they would ask is modified Weidmann flap surgery. So I have explained it in very detail. I hope you have liked my video, and please don't forget to like, share and subscribe. Thank you.